The next set of questions are on the medical treatment. Ask how was Guillain-Barré diagnosed and what types of tests did they use to diagnose it. When I first got to the urgent care place, right when it was first happening, they did, I guess, a stimulus test. I don't really know what it's called, but they took this metal prong thing and they struck it and they put it against my feet to see if I could feel the vibrations going up my legs. And when I couldn't feel that, the doctor at the urgent care knew that something wasn't right, and so he went ahead, sent me to the emergency room with a form saying you check for Guillain-Barré. And so then I got to the emergency room and they did lumbar puncture to check my protein levels to see if they were elevated, and then they also they did check my reflexes, and they checked them in my ankles, my knees, in my arms and my wrist, and from waist down there was pretty much no reaction in any of my reflexes, and then in my arms just very dead, if not none there at all, or very slow, I guess you'd say. And then later they did a nerve conduction study, which is probably the worst thing that you can ever put somebody through. So that wasn't fun, but I guess through the cumulative tests and all the different varying test results, they were able to make pretty much a textbook decision that it was Guillain-Barré, and like it followed pretty much right down the normal path of that. And then the next question said, what medications were you or are you currently on? Were your medications changed at any point and why? When I was at the hospital, they gave me, I was on, they did the 5 days of IVIG. I guess you can either do IVIG or the plasmapheresis. Neither is better than the other, but for me, they just decided to do the IVIG for 5 days, and then they also did just gave me a lot of vitamins, a lot of minerals to like boost my immune system and just do all the different things so that my body would stop fighting my immune system. My nervous system, and it would start fighting the actual virus. And then after I got out of the hospital, they gave me Neurontin for like the nerve pain and I guess help the nerves repair. And I still take that now. Not as often. I took it for a while. I took it a lot just because it was pretty painful when the nerves are starting to fire again, or starting to repair, I guess. And but now still I'll take it when like if I have a bad week or something. And then they also gave me a lot of different like multivitamins just to help kind of like boost my immune system to stop me from getting sick, I guess. And they also ask any other interesting medical treatment, any other interesting types of medical treatment. Not anything that I can think of off the top of my head. The Neurontin never bothered me, so I never had a change from that, and it was I never had any of the weird side effects they talked about. It really helped. It was really good. It still really helps. So with medication stuff, I got pretty lucky just because everything worked the way that it needed to, and helped me get better a lot quicker.